Major support for Carolina Business Review provided by Grant Thornton. Operating in more than 100 countries, our tax, audit, and advisory professionals specialize in helping companies unlock their growth potential. Colonial Life, providing benefits to employees to help them protect their family, their finances, and their futures. And Sonoco, a global manufacturer of consumer and industrial packaging products and provider of packaging services with more than 300 operations in 35 countries.
It seems we live in a time of profound transformation. That is not an understatement. Certainly innovation and certainly development, but at the same time, it can be frightening, unsettling, stressful, and uncertain. Welcome again to the most widely watched and longest-running source of Carolina business, policy, and public affairs seen each week across North and South Carolina for almost 29 years now. I'm Chris William. Thank you for supporting that. We are careful not to make sweeping promises about alleviating any anxieties that you may have about the future on this program, but we do hope to unpack some of the most critical issues here in our region. And we will. We'll begin in a moment. And not too much later, we're joined by the Chief Executive Officer of Burlington-based life sciences giant LabCorp. David King joins us again.
Gratefully acknowledging support by Martin Marietta, a leading provider of natural resource-based building materials, providing the foundation upon which our communities improve and grow. Blue Cross Blue Shield of South Carolina, an independent licensee of the Blue Cross and Blue Shield Association. Visit us at southcarolinablues.com. The Duke Endowment, a private foundation enriching communities in the Carolinas through higher education, healthcare, rural churches, and children's services. BARINGS, a leading global asset management firm dedicated to meeting the evolving investment and capital needs of its clients. Learn more at barings.com. On this edition of Carolina Business Review, Catherine Truitt of WGU North Carolina, Russ Keller from Global Alliance South Carolina, and special guest Dave King, CEO of LabCorp.
Welcome again to our program. Russ, welcome from Charleston. Catherine, good to have you back.
Thank you.
Catherine, let's just spend a little bit of time on student debt. It is obviously, if not a headline around education, it's certainly one of the subtopics that continues to bubble up. Is it hyperbole to say that it's a crisis?
Absolutely not. It is a crisis with a trickle-down effect. Right now, student debt is about $1.6 trillion in the U.S. In North Carolina, $44 billion makes up our student debt. And the average North Carolinian owes about 30 grand in student debt.
And I'm assuming we could make a jump to South Carolina that it might not be 44 billion liability, but it's got to be in the tens of billions somewhere.
Yes, the price of a college degree has increased about 8 times faster than wages have increased since 1989.
This is not sustainable.
No, it's not sustainable. And I would argue that the model that we have for financing higher education is not sustainable either.
So when do we hit a tipping point, really? When does it become, well, we should have done something 5 years ago?
So Congress is looking at reauthorizing the Higher Education Act. I hope that there will be some innovations that are part of that process that will provide some relief. We've done a little bit in getting rid of some of the bad actors who are partially responsible for this debt, and those would be for-profit universities that had very low outcomes. And so you have this perfect storm of people paying a lot of money for a worthless degree, not completing their program or unable to complete, and therefore in debt. Quite frankly, Chris, in any other lending context, what the way student loans work would be considered predatory lending.
Well, strong words. Russ, I'm not going to ask you to wade in on the official capacity or whether you think that that's true or not. However, Global Alliance South Carolina, I mean, correct me if I'm wrong, but a major component of this is the higher ed and the workforce development piece. So are you concerned about how these, as Catherine described, the student debt and what happens?
We are concerned, and we've seen several of the universities in South Carolina reacting to that and expanding their opportunities for international connections, international programs. That's the space in which the Global Alliance plays. We play everywhere from student and faculty exchanges through research university collaborations, and then on to collaborations and partnerships between mostly small businesses with the objective of developing new products for new markets that neither company could develop on its own.
What could South Carolina learn from Israel, Estonia?
Well, certainly there's a great entrepreneurial spirit in both places. I think one of the things that I've seen and I've learned is in Israel, there's as much pride in failing in starting a company as there is in succeeding, because they understand that sometimes it takes 2 or 3 or 4 tries, but the lessons that are learned eventually lead to success. And so I think that's a great lesson.
So you think as the U.S. might demonize or make it a pariah to be a failure in business, you're saying not so much in Israel? That's
definitely the mindset that we've seen over there.
And you're nodding along with that, Kathy.
You know why? Because that's the exact same mindset in U.S. business that we have in education, that it's not okay to fail in terms of what happens in the classroom. We need to graduate students who maybe have that entrepreneurial spirit through the ideas that it's okay to fail and then learn from those mistakes and move on, rather than the idea of a one and done education.
You know, Keller, I don't want to chase this down too much because this is a very deep topic, but you talked about business and the education and that interaction between the two. Do you get the sense now with things like My Future NC, Best NC, there is a new head of the North Carolina Chamber. South Carolina's already kind of zeroed in on this, but do you think that all of these business groups are coming back to education as being a key role? I mean, front and center, maybe the key role in business development and economic development?
I do, and the reason why is because the data shows CEOs and HR executives, et cetera, the issues that we have in meeting workforce development. North Carolina is on pace by 2024. Job growth is going to outstrip population growth. We have always been able to meet job growth in the past because we are a net importer of talent. Mm-hmm. But when you look at attainment gaps in our rural areas, it's not sustainable for us to continue to hope that in-migration solves our workforce problems. We have to start educating the people who live here, and that includes people in the rural communities.
Russ, how do you solve the workforce problem when you're talking about it internationally? How do you make sure that people know, no, South Carolina has the talent, we can backfill what you need, and really mean it?
Well, I think one of the strengths that we have in our state is our technical college system.
You think it's underutilized?
No, I'm not sure it's underutilized, but I would echo the observation that the challenge that I see in our state is in the rural areas, and being able to capture that talent and develop it. We've just had in the state of South Carolina a couple really good years from recruiting large manufacturers, and that put a real drain on being able to fill positions. So the question becomes, once Boeing, once Volvo, once they have met their workforce needs, how are we positioned for the next rush? Mm-hmm.
Mm-hmm. Well, and speaking of the next rush, we have heard, and we've talked about it on this program, with commerce in both North and South Carolina, that the pipeline is not as robust and might be the natural break that you need. Have you heard these same things about the pipeline in economic development?
I've heard it. I'm not a direct participant in a lot of those discussions, but clearly we see it with the small businesses that we're connected to, that there's just a fierce competition for talent.
How does it show up?
Openings that stay open longer than you might think they are. In certain niche technology domains, not being able to get somebody to take a job.
Okay. That'll be the last word. Stay with us. We're going to bring our guest on. Speaking of education, Next week on this program is the chairman of the State Board of Education. His name is Eric Davis. Chairman Davis is at the point of the spear when it comes to policy in the Old North State, and not just about setting policy, but getting all of the players in education in North Carolina to work toward one goal. And it may be teacher pay, it may be principal pay, but it has to be better outcomes for education. We'll talk to Chairman Davis about that next week. And also an encore presentation. He is the Chief Executive Officer of Lowe's. Marvin Ellison is back on our program as well. According to statistical analysis, the average tenure of a Chief Executive Officer of a Fortune 500 company is around 5 years. Our guest has clearly beat those odds, well beat those odds, with almost 3 times as much in the C-suite of the now 60,000 employee strong LabCorp. He is staring at retirement from the top job, but not from the company. At the end of October, he will become the executive chairman of the board of Burlington-based North Carolina LabCorp. We welcome back the current CEO for a few more days, David King. Welcome back, Mr. Chairman.
Thank you, Chris. It's an honor to be here.
David, a smart CEO on this show once said that you're never as good as your numbers, you're never as bad as your numbers. But when you look over the last 14 years or so, when you started in 2007 at LabCorp, you have more than doubled, you almost trebled the top line. The employment has gone way up. The stock has gone way up. The footprint of LabCorp employees in the Carolinas has gone up. You have to be feeling pretty good about the effort that you and your team have done.
We've had a terrific run, and we have a great, not only the leadership team, but I always think it's really important to emphasize, a substantial amount of our revenue, $7 billion, comes from laboratory. That means phlebotomists who draw blood, couriers who drive cars, lab techs who run tests, physicians and PhDs who look at the results. And it really is a complete team effort to run our business successfully. And we've had a great team, and we've improved the quality of that team very significantly over the 13 years.
So you're going from CEO to executive chairman. So, and pardon me for saying it this way, you're not really leaving the company, are you?
I'm not really leaving the company. I think, my role is to help my successor, Adam Schechter, get established as a CEO. He's an outstanding executive. He's been the number 2 executive at Merck for a number of years. But as I learned when I became CEO, going from the number 2 executive to the number 1 executive is a big change. And my job is to help him be successful in that change.
Catherine, question?
I'm sitting here wondering a couple of things. First of all, has LabCorp seen the hiring difficulties that we know X amount of CEOs are reporting every year? Do you have trouble finding the talent that you need? Absolutely.
We have 61,000 employees. They range from phlebotomists and cage cleaners all the way up to PhDs and MDs. But I thought the earlier discussion was very much on point. The Alamance County is still relatively rural, and so the community college is a vital source of employment for us, and we've supported it. I think it was probably 5 or 6 years ago, the last cytotechnology training program in North Carolina was closed at the state university level, and so we actually funded a program at Piedmont Community College to train and hire the cytotechs. So there's going to be a critical shortage of laboratory technical staff, MLTs, medical laboratory technicians, and we don't see an obvious answer as to how that's going to be solved.
Well, you're obviously on the cutting edge of what businesses are going to have to start doing in the future, which is to fill those voids themselves.
I think the public-private partnership around education is going to be critical to meet the needs, particularly because our business is now so much technology driven, whether it's IT or whether it's the technology around gene sequencing, and if we want people to be qualified to do those jobs, then we're going to have to take some responsibility for training them.
Mm-hmm. And I would say that technology, clearly, what we see in some of the collaborations that we sponsor it's just exploding in the medical arena. I mean, that's got to drive dramatic change in not only who's in your workforce, but what skills you're going to need. You know, telehealth, remote medicine. I mean, it just how does that impact such a big company?
Well, of course we on our own health side, we have 60,000 employees, and so we see a wide range of medical conditions, of treatments for medical conditions, of new drugs, biologics, you know, new modalities of treatment, all of which from an employer perspective drive cost. So how as an employer do you deal with all of this technology that's driving, you know, continuing to drive the increasing cost of health benefits, which we're strongly committed to providing. On the laboratory and the diagnostic side, I mean, the things that are being done today, cell and gene therapy, you know, immuno-oncology, where we've figured out how to switch the immune system back on when it stops working, so that the immune system essentially turns against cancer and stops the cells from reproducing. You know, it's unimaginable that this could have occurred 10, 15 years ago. And one of the things we always, you know, we point to the success of turning HIV from basically a death sentence to now in the developed world just a chronic disease which can be treated with laboratory testing and medication. We talk about, you know, 25 years ago childhood leukemia was pretty much a fatal disease. Now we know that there are actually multiple different strains of childhood leukemia, and we have a 90% cure rate because we can identify exactly what treatment is appropriate.
Let me come back to this thing that Catherine brought up, David, and that's the idea of LabCorp is headquartered in Burlington, Alamance County. It's between the triad and the triangle, and you are surrounded by a rural area. What would keep a Fortune 500 company to say, no, we're going to stay here, we can access talent, we feel we're pretty good? And I heard what you said about the cytotech course. Did you fund that because it was a charitable thing to do, or you saw some benefit back to LabCorp and the industry that built on that whole idea of being exactly where you're located?
Yeah, we funded it because we needed the people, and we also believe that North Carolina needed a program to train cytotechs, because the cytotechs are the ones who read the pap smears and the slides that, you know, prevent women from developing cervical cancer. So there is a critical need in the medical profession for an adequate supply of cytotechs. In terms of why we're still in Burlington, you know, we just celebrated our 50th anniversary last week. We were founded in Burlington. We received our first specimens on October 6th of 1969, and we had a terrific event at which we recognized what we called our first group of LabCorp stalwarts, people who contributed, you know, the unsung heroes who contributed to the country. But the most profound thing to me was that the three founders of LabCorp were all there, the Powell brothers. Jim Powell, our first CEO, who was the CEO for over 20 years, spoke about, you know, the evolution of the company and the culture. And from my perspective, Burlington is our home. It's always been our home, and as long as I have anything to do with it, it will be our home.
Okay. All right, Catherine.
So what would you say is the most exciting new innovation that's going on at LabCorp right now?
I think on the drug development side, you know, the emergence of a much more robust capability around personalized and precision medicine. So, you know, we can do testing that's designed to look at your specific genetic characteristics and how that will affect the way in which you respond to a drug, for example, or in which the way we think that the disease will progress, how your disease should be treated, and where you fall, you know, kind of within the realm of other people who have similar diseases. So it's an area that, you know, has been much talked about over the past 10 years. I think we're really starting to see the momentum behind understanding that, you know, we can't treat everybody who has diabetes with kind of the peanut butter approach of, you know, well, everybody just needs diet and exercise, and if you just do that. It's really not the case, and there are people who are predisposed, and there are people who have more acute symptoms, and we have to mold medical treatment to the way that people's disease appears and progresses.
Mm-hmm. We see some of that in the collaborations that we sponsor through our R&D projects. I'm wondering if you have an increased connection with international partners in what you do and how that factors into your business?
We do. When we acquired Covance back in 2015, we went from basically being a two-country business, U.S. and Canada, with a little bit of Caribbean, and to being now we have offices in 60 countries and do business in 100 countries. And you know, it's been an amazing transformation because we see the entrepreneurial innovation that's going on in Israel or that's going on in the former Eastern Bloc. We see what's going on in China, Japan, Southeast Asia, and Singapore. And so there's a tremendous amount of medical innovation that's going on around the world, and we're fortunate that we can participate much more directly in it.
What do you see as kind of the long pole in the tent to getting something from R&D into practice? Is it still getting through all the FDA approvals and clinical trials, or what's the big long pole in the tent we can work on?
The regulatory environment in the U.S. is somewhat challenging. I actually think that the FDA, particularly under Commissioner Gottlieb, did try to accelerate a lot of the regulatory processes that I think over time had gotten bogged down. And our hope is that will continue. I think Secretary Azar similarly is very much, pushing for innovation. I think for us, the long pole in the tent is really, there are so many things that can be done at micro scale, but we have to be able to do things at macro scale. And so somebody comes in and shows us a test that they can run, 10 times a day with great success. We have to be able to run that test. We handle about 500,000 patient encounters a day and do over 1.5 million tests a day. So we have to be able to do things at scale in the U.S. and around the globe. And getting things scaled up to where they work and where you can be satisfied that they work over and over again is really the toughest part of making R go to D.
You think about the industry more than just a testing company. There's no doubt about that. David, when you hear the challenges and read the headlines around opioids, what's the remediation for it? What do we need to do? How do we need to manage that?
Well, if you look at the history of what happened with opioids, there was a very small study done on hospitalized patients in Massachusetts that showed that a hospitalized patient could be successfully treated with opioids for pain without becoming addicted. Unfortunately, that combined with the proclamation that the freedom from pain was one of the basic human rights of healthcare led to an explosion of, it's very different to manage a patient, as one of my hospital CEO friends, it's a lot harder to manage them outside the nest than when they're in the nest, and once they leave the nest, you have a lot less control. And so I think the combination of this misguided view that opioids could be administered to patients without them becoming addicted, and that people had a quote-unquote right to be free from pain, just led to a massive amount of, and not in a massive amount of over-prescribing, but in a way in which physicians were trying to help patients. And the unfortunate thing is in my view, as is often the case, is that the regulatory response has been to say, well, we just crack down on prescribing and we make it impossible to prescribe opioids. And so now people who are legitimately in pain are struggling to access opioids. And the other part of the challenge is that many people move from opioids to black tar heroin and other types of no improvement in going from one of those.
The self-medication.
Exactly, the self-medication. So, I think the biggest challenge is to get all of the people who are responsible for formulating the policy together at the table. So you need the physician groups, you need the distributors, you need the pharmacies, who are actually doing the distribution and selling the medication, and you need the government at the table, and not just the federal government, but the state governments too, because there's a tremendous amount of exposure and management of the opioid crisis at the state level, and a lot of opioids are paid for by Medicaid. So you need all those parties at the table to think about, from a policy perspective as opposed to a finger-pointing perspective, how do we implement tools and techniques that are going to help improve the situation with a a very tough problem and in many cases an underserved population. Back to the rural-urban, the places that have been most devastated by opioids have been rural communities in West Virginia and Ohio, and it's just devastated those communities.
David, I wish we had more time, and we build this internally as your exit interview out of your job. But, I want to say congratulations for a job well done, and that's not me saying it. That's a lot of your colleagues and others that know of you. So thank you for the leadership that you've shown over the years, and I know you're not going too far, but still it's worth saying thank you and congratulations.
Thank you, Chris. I very much appreciate it.
Absolutely.
It's great to be here.
Nice to see you. Russ, welcome to the program. Catherine, good to see you again.
Thanks.
Thank you.
Thank you. Until next week, good night.
Major funding for Carolina Business Review provided by Martin Marietta, Colonial Life, the Duke Endowment, BARINGS, Grant Thornton, Sunoco, Blue Cross Blue Shield of South Carolina, and by viewers like you. Thank you. Promotional consideration provided by Business North Carolina Magazine. For more information, visit carolinabusinessreview.org.